So here I want to share with you about the current issue in Malaysia, COVID-19. So, what is COVID-19? Coronavirus disease, or we call COVID-19, is an infectious disease caused by a new virus. The disease causes respiratory illness like the flu, with symptoms such as cough, fever, and in more severe cases, difficulty in breathing. Malaysia announced its first COVID-19 cases in 25th January, involving 3 Chinese tourists who had entered Malaysia via Johor from Singapore on 23rd January. The number of cases then rose to 22 by 16 February, representing a first wave of cases. Then, the second wave of cases began on 27 February, and since then, the number of people affected by the coronavirus has risen to more than 1,000 people. There are several clusters of COVID-19 infections in Malaysia. The biggest one so far is linked to a tabligh gathering at the Masjid Jamek Seri Petani from 28 February until 2 March. About 16,000 people, including 1,500 foreigners, attended the event. More than 10,500 people from the gathering have undergone screening with over 800 testing positive so far. On 23rd March, 4 more deaths linked to COVID-19 were recorded, while 212 new infections involving this virus were detected nationwide. The latest infections bring the tally of cases in this country to 1,518, while total deaths stood at 14. Speaking at the Health Ministry daily press conference on COVID-19, Health Director General Dato Dr. Nur Abdullah said that 123 of the cases were linked to a cluster at the Seri Petani Mosque. He said currently there were 57 cases that have been treated at the intensive care unit or ICU, with 27 requiring ventilators to aid with breathing. Meanwhile, 20 of COVID-19 patients had fully recovered and were allowed to return home, bringing the number of people cured from the coronavirus in Malaysia to 159. Currently, no vaccine to prevent COVID-19. You can protect yourself and help prevent spreading the virus to others if you wash your hands regularly for 20 seconds with soap and water or alcohol-based hand rub. Second, cover your nose and mouth with a disposable tissue or flex your elbow when you cough or sneeze. Third, avoid close contact with people who are unwell. Fourth, stay at home and self-isolate from others in the household. And lastly, don't you ever dare to touch your mouth, face or nose when your hands are not clean. So that's all for me. Stay at home and be safe everyone. Bye.